A patient comes, as you said, doctor goes, says, do a angiogram. But at that time, since it was not available, detection was a very difficult factor. But as you said, you have to judge it only clinically, sir. So, how do you see this transformation from judging clinically to now coming to machines?
I expressed my concern about the recent advanced investigation because most of the doctors, clinicians now are attracted with the overdiagnosis and overtreatment. Is now a very big issue for the patient. And they are keeping aside clinical examination, history taking, meticulous examination of the patient. These are now on the shadow. And the doctors all are jumping to the advanced techniques. The human body now has been fragmented from one system to organ to tissue cell to genetic level. And if you look at the radionuclear medicine aspect, you will see the ultrasound, CT scan, MRI, PET scan, and so on.
Welcome to Hello Doc. Today, the word is so much engraved into various types of diseases, problems, and everybody is running around doctors, medical colleges, nursing homes. But still, the people are not getting what they want. And that is why the medical fraternity has a very important role. So, ARYA Pharma Lab brings in this program what actually the doctors are going to offer to the common man. That is our motto in this program of Hello Doc. So, every week we will be coming out with one doctor who will be with whom we will be discussing on how he is going to serve the society. Today we have with us a very senior physician from Nepal, a renowned physician from Nepal, Dr. Shubhesh Raj Kayastha. And we will be knowing about his journey, how he has progressed. So, sir, when it comes to doctors, sir, when a patient goes, he feels like he has gone to a god, sir. And we would like to know about your journey, how you have started coming into this profession, how what are the challenges you have faced, and what is the future prospect you see, sir.
Yeah, I have a quite long journey of my medical career. Actually, I passed on 1983 from Bangladesh, and I was the first Nepalese who graduated from Bangladesh the first time. The Bangladesh government have approved MBBS seat for Nepal, and we were the first batch. We went Bangladesh on 1978, when President Ziaur Rahman was the president of the country. So we went with the scholarship, government scholarship. We were 3 students, and I graduated there from 1983. I graduated my MBBS. After that, I did my residency in Dhaka, in medical college. So I completed the 2 years residency, and I did my postgraduate diploma in Dhaka University. So I came back in 1986, came back to Nepal, and my first appointment was in the far west region, Mahendranagar. That's close adjacent to India. We have Banbasa or Khatima, we call it, near border was there. So during that time, the condition was horrible because the far west region where I worked there for last 30 years. And the condition was very horrible in terms of road transportation because the bridges were Kailali bridge, as you are familiar, I think, that is a famous bridge in Nepal, hanging bridge. And that bridge was not constructed, and many other 40, 50 bridges were we have to cover, we have to cross the river. So the transportation was horrible, and that time the far west region was isolated from rest part of the country because of transportation. So naturally, there is a huge deficient of health manpower in the region. So there were a handful of doctors working in the zonal hospital. There was two zonal hospital. One is Mahakali Zonal Hospital in Mahendranagar and one is City Zonal Hospital in Dhangadhi. So I worked in the Mahakali Zonal Hospital for about 15 to 20 years. So the condition of the peoples were very horrible. They were very poor, low socio-economic condition, and illiteracy was very high. The Human Development Index scaling revealed the lowest in the country. So the suffering was quite a big than the health facilities. So this adverse situation motivate me to stay over there and to serve the people. So I was very much motivated to serve them because there is severe lack of health manpower over the region. Not because of the financial background I serve purely on the background of mankind. So I retained there for 40 years. And personally, I have two daughters. My wife is also a doctor. She also worked with me in the Far West region for nearly 20 years. She was with me. Later, she retired. And I have two children, two daughters. My elder daughter, she just graduated, post-graduated in pediatric department, and she served in Karnali Swasthya Vigyan Pratishthan, Jumla. And now she is working with me in Dhangadhi. And my youngest daughter, she is now doing her residency, MD residency in Christ Hospital, Kathmandu. She is in second year now.
So, sir, 40 years is a long, long
Yeah,
time.
yeah.
So, you would have seen a changing era in the medical history in 40 years, sir.
So when I at the beginning time, when I joined the government hospital, even I still remember now, I used to diagnose the patient of MI clinically, myocardial infarction. That means the heart attack. We don't have ECG machine even to diagnose at that time. And now the things have been changed in my workplace. Now angiograph and coronary PCI service is available in such a level. Such a vast change I have observed during my stay.
Because
Yes.
compared to, sir, now they say a patient comes, as you said, doctor goes, says, do a angiogram. But at that time, since it was not available, detection was a very difficult factor. But as you said, you have to judge it only clinically, sir. So, how do you see this transformation from judging clinically to now coming to machines?
Yes, of course, there is a vast change, and today I have talk program today, and I express my concern about the recent advanced investigation because most of the doctors, clinicians now are attracted with the overdiagnosis and overtreatment is now a very big issue for the patient. For the and they are keeping aside clinical examination, history taking, meticulous examination of the patient. These are now on the shadow, and the doctors all are jumping to the advanced techniques. The human body now has been fragmented from one system to organ to tissue, cell to genetic level.
Genetically, yeah.
And if you look at the radionuclear medicine aspect, you will see the ultrasound, CT scan, MRI, PET scan, and so on. So these things are important for the diagnosis, but routinely should not prescribe because most of the now tendencies of the doctor is to overwriting prescriptive investigations.
So, sir, when you have started, basically the clinical aspect was more important. Today, the
Yes.
diagnostic aspect has become more important
Mm.
because when you were there, the patient comes, you have to judge it clinically. Now,
Clinical.
the doctor, without judging anything,
Right.
says you go for this thing.
Yes, yes. Without touching, without listening, they just listen 2, 3 symptom, and according to that, they prescribe all the investigation.
The second thing is, sir, maybe 40 years back, metabolic syndrome was in patients of 60, 65, 70 years.
It was
Today,
rare.
you are seeing, must be seeing metabolic syndrome in patients of 30 years, 40 years, sir. So, what change has brought this metabolic syndrome age down, sir?
Yeah, before 40 years back, the diabetes, hypertension, coronary artery disease, these are the rare disease. Handful of people have diabetes only. We can identify the name of the patient
Mm.
in memory. But nowadays, it is a such epidemic you cannot count. So the reason behind is lifestyle, changing of lifestyle, uh, and most of the patients now are sedentary. People are sedentary because of they are using hugely the modern techniques like mobile phones, like vehicles, and all physical activities became zero. And number second is the poor dietary habit. Unhealthy dietary habit is also they are taking lots of fast food. People don't have to time to cook the foods, so they consume ready-made foods and all things. And number three, lack of exercise and the stress because the now the generation they are facing with quite big challenges. So the stress is very important part for these all non-communicable diseases.
Mm.
So these are the important factors.
So, sir, what advice you will give to today's youth? As you said, lifestyle is is one of the causative factors. Poor diet again is one of the and stress, as you mentioned, is also a causative factor. So, what advice you are going to give to your youth today, so that they should not be in the trap of metabolic syndrome?
Yeah, the most important message is uh, to spend a healthy life. Number one is the exercise, physical activities. They must involve in the physical activities daily according to their age. And second is dietary habit. So low carb diet, high fiber diet must be restricted in the sugar and salt. And you know, these all the intervention strategy doesn't cost a single pie. It's free of cost. This is just change of behavior. So diet, high fiber diet, avoid carbohydrate as much as possible, avoid protein, animal protein as much as possible. And third is the avoidance of stress. So these 4, 5 things, if they follow strictly, I think they can live in a healthy way.
As you said, sir, stress, you have again said, is it because of the luxurious lifestyle people are having today and they want even better luxury? So that
Yes,
is this because stress is one of the major factors?
yes, yes. That is the major factor. The stress is now is because of competition. The era is competitive era. They want more things within short periods. So they want to do hard job and they are thinking and thinking more and more. So because of these things, the era is competition, not like before.
Mhm.
They have very high expectation in every aspect of life.
Mhm. So apart from changing lifestyle and diet, sir, any particular other thing would you like to advise to the
Yeah,
society?
yoga, meditation, these are also a very important part to minimize the stress, to keep the mind in peaceful state. These are also very important part. Mm.
So, sir, as you said, yoga, meditation,
Yeah,
changing lifestyle, changing food habits, all these play a very
yeah,
important role. And I hope that after seeing your message, the society may adopt some of these things, sir,
Yeah.
for a healthy life, sir.
Yes.
Thank you, sir. Thanks
Thank
for
you. Okay.